Hello, it's Adrian Madril again for Peace of Mind on Channel 5. And today we have a wonderful show for you. We have Melinda Bailey from Southeast Kansas Mental Health. She's the Director of Children's Services. And so we're going to get another perspective. We've had a few people on here from Southeast Kansas Mental Health. See, you got to love watching my show because you never know where I get tongue-tied. And so we're going to get a different perspective, see a different person with a different job role and what she's passionate about, and getting that information out to you. Hopefully, like with the rest of my shows, you'll find something valuable in it that you can take and apply to your life, and maybe apply it to someone in your family. So at this time, I'd like to thank you for coming on the show, Melinda. I appreciate you being here.
Thank you.
And tell my audience a little bit about what it is that you currently do. Maybe also give a little bit of background, because you've been with Southeast Kansas Mental Health for quite a while.
Right. I started with the Mental Health Center in 1994. And Southeast Kansas Mental Health Center is a 6-county mental health center. And so we cover Allen, Anderson, Bourbon, Lynn, Neosho, and Woodson counties. We offer a huge array of outpatient services for children and adults in this area. If you are wanting outpatient services, we have everything from outpatient therapy to psychiatry. We have children's programming and adult programming, such as case management, which we can talk a little bit about. Attendant care, which is, I think of as sort of like a big brother, big sister program, and a lot of people don't know that we offer that. Okay. And then we have social groups for kids that have been diagnosed with a mental disorder, and we have groups that run throughout the summer all day long. They're kind of like day camps, and then we have after-school programming throughout the school year.
Well, it sounds like there's quite a bit there, and as it was all rattling off, I was thinking to myself, wow, I did not know that we had all these programs available. It sounds like there's something for every age group, and quite honestly, probably something for everyone.
Well, and I think the thing to remember is it sounds like a lot of things. It can be a little confusing of what's this service, what's that service, but the main thing is, are you having some issues, or are your children having some issues that you'd like to visit with somebody about? And that's really an easy process to start. You can call any of our local offices and just say, hey, I'd like to get in, we're having some issues, we'd like to talk with somebody about that, and they'll schedule just that first appointment, and then you would meet with a clinician that would assess, what's going on, would listen to you, what's going on with your family, and then talk about, hey, these are some of the programs that we offer that you may be interested in, and then really you can just kind of pick what fits for you or your family.
Okay.
The different programming.
Okay. Now, I know you're really passionate about statistics, and just a few moments ago you were saying if you're having some issues.
Yes.
For a lot of people out there, including myself, how do I know what are issues? What should I be looking for? What are symptoms? And then you could probably tie into some of the statistical information for some things.
I would be glad to. I really like when I visit with people to let them know how common mental health disorders are, because a lot of people feel like, oh, maybe Sally's just a little down in the dumps, but we'll get over it, we'll get past it, not such a big thing. But really, if you look at the national statistics, 9% of children and adolescents will have some depressive symptoms at some point in their lifetime. And so I think that really normalizes it, that there are a lot of kids out there that suffer from depressive symptoms. When our children fall off of a bike and break their leg, we know where to take them. But if they're having problems like, all of a sudden we're getting stomach aches at bedtime, or stomach aches before school starts, or when we've got a big test scheduled, we're really starting to get sick and mom's not sure exactly why that's happening, but it seems to be happening more and more often. Those are the times when you start thinking, well, maybe something else is going on. But a lot of families don't know, where do I take my child if they're having issues like that? Anxiety is something that's so prevalent with children. Up to 13% of children will experience anxiety. There's a really good study that was done in 2004 that says up to 13% of children at some point will have anxiety. And we all get nervous, if we've got a test or we're starting a new job, that's normal. It's normal to have that anxiety. But again, if we're having the stomach aches, the heart's racing, unexplained physical symptoms that just really doesn't appear to be a medical cause for, where do you take your child to just see what's going on with that and to get them some support? And so that's when you would call in and just say, hey, I'd really like to visit with someone, just to talk and let them know what my child is going through, see if it's something that we could get some support. And then the therapist that would be doing that assessment in that first appointment would explain, here are the programs we have. Outpatient therapy would be, coming in once every couple of weeks to just let the child have an outlet, to really be able to visit about the symptoms that they're having, because it's just so important as parents that we make sure our kids have an outlet to visit about how they're feeling, to express the emotions that they're having. School's not easy.
Oh, that's definitely true. I remember going through school. I probably wasn't the best student, but you mentioned a couple of things that that if kids are getting stomach aches, well, kids get stomach aches. Sometimes they sneak food. Especially not the best, healthiest food. I'm gonna steal this broccoli and eat it later. That's not what happens.
Sure.
Usually it's soda pop and candy or something.
Exactly.
But if it's a reoccurring thing,
if you're starting to see a pattern, and like I talked about with the anxiety, if you've got a child that before a big test is always getting really anxious, they're not sleeping well, they're having physical symptoms like stomach aches, headaches, heart's beating fast, I don't want to go to school. And, if that happens a time or two, that could be completely normal. But again, it's just about being a parent, seeing those patterns. Is it continually happening? Is it starting to impact that child's daily activities? That's when you stop and think, okay, maybe there's something going on here and we need to get some support.
So one of the issues, if you will, I'm not finding the right word that I'm looking for, that people have is they don't want to have themselves or their children labeled, or the children, if they're old enough, don't want to have that stigma associated with that. So it's not necessarily I'm healthy, I'm mental disorder. There's a
continuum there.
Continuum, thank you. I need to do shows after lunch.
And there is still so much stigma there. There's so much stigma there. We try to do education and normalize it for people, and it's not somebody's fault if they're having depression symptoms or anxiety symptoms. You're not crazy, that you're not mentally ill just because you're having issues with some depression or some anxiety. And so it's really hard sometimes for people to pick up the phone and make a phone call and say, hey, I'd like to get some support, because the term mental health center can be a little scary if you've never been inside the doors. But again, if we hurt our leg, we know we go to the doctor. If we have problem with vision, we go to the doctor. And really, we need to really keep trying to reduce the stigma of if I'm having some problems, because 1 in 4 people at some point will have some sort of issue, depression, anxiety. 3% of Americans have eating disorders. People struggle with things, and we need to be able to feel comfortable, and that's our goal at the mental health centers, to help people feel more comfortable about it's okay to come in. That doesn't mean there's something wrong with you. It means you're noticing that you're struggling in an area. Just, again, if you've got vision, you go to the optometrist. If you're having hearing issues, you go and have that checked out. If you're having some issues with family or with anxiety, come in and visit with somebody about that, because there are so many wonderful things that you can get support in.
I guess my question is, if you're on this continuum and you're not far enough along to be clinically diagnosed, is there still help that we can get?
Absolutely.
Okay.
Absolutely. As far as our community-based programs, like we have a program called Children's Case Management, whereby a child is matched with a staff person that goes out into the community and works with them. Now, to qualify for that program, those are going to be kids normally that have been diagnosed with a mental health disorder. It may be depression, it may be attention deficit hyperactivity disorder, maybe anxiety, maybe there have been some abuse issues. And so those kids, normally would have been diagnosed with something. But just to come in and get counseling and support in that way, you don't have to necessarily have a diagnosis.
Okay. So you can get some sort of counseling, you can get some maybe techniques to help them deal
Correct.
with stress and everything.
We also have parent support groups that we offer once a month.
Oh, that's awesome.
Yeah, we have those in Iola. You do not have to be a member of the mental health, of our family to attend those
So
meetings.
any parent can go to that.
Any parent can go to that meeting, and we would love to give people information about that if they want to call our local office.
So for all those parents who tell me I don't know how to control my child anymore,
Yes.
there's probably stress issues on both sides, and support would be beneficial.
Yes.
I think that's the hard part for a lot of us. A lot of us feel that we have to fix the problem ourselves.
Right.
And before we get to that point, a lot of us feel it's not a problem. If I just ignore it, it'll just go away. But what we really do during that time period is we allow it to compound more and more, so the problem is so much worse by the time they break down and say, okay, I need help, where do I get help?
I'm so glad you mentioned that. The national average is people will wait 5 years after having symptoms before they will get help.
Oh, good, I got 4 more years.
5 years, and that's too long.
It is
you know
too
why?
long.
That's so much needless suffering.
Well, and
to
I
wait that
think
long.
one of the things that we don't realize, you say, and I know your focus is on children, and I'm kind of backdooring it back to the children here.
Uh-huh.
But say you're an adult and you're having struggles, hurdles in life that you just don't know how to deal with. And you find that I'm just gonna, I don't have time to deal with this right now. I'm gonna focus on something else, and they don't know how to effectively deal with those issues. That it may not be as detrimental for the parent short term, but the child hasn't learned coping mechanisms yet, and so that child is being exposed to all that. And just like you would find that that you would be in a community, in an environment, maybe with a friend, and you notice that something's just not right with them, but that something, something's wrong, and then they finally tell you about it. That child is very, very observant too. That child will be able to take and notice there's a change going on, notice that you're stressed, and that affects that child too.
Absolutely.
So it's so important not to wait till the last second.
Right. And just because someone's having struggles doesn't mean they have to come in every 2 weeks for that traditional, clinical therapy. If they want to come in and just talk with the therapist and say, hey, I need some resources, what's a good book that I could read to deal with this? What are some self-help strategies? We're there for that too. We have a huge library of materials. We know good websites. We know good hotline numbers. So it doesn't mean just because you make that initial call and go in and talk with someone that then you're going to have to go every other week and talk to someone. We can just give you some really good resources if you'd like to look more in the self-help.
And that's so very important too, because when you go to the bookstore or you look online, it's just like a Google search anymore. It's like going to Walmart and looking for one item. There's 36,000 of them, and you don't know which one to choose, and
Right.
they, all have the flashy words, but the content may not be there. And so having somebody to say what is a good book, what is a good video series, what is something that I can learn from to help me deal with these things. I'm a consulting hypnotist. I don't know if Shauna had told you that, and so I like to think I help people before they get to that point of wanting to go to Southeast Kansas Mental Health or needing to go to Southeast Kansas Mental Health. And so I find that is so very important, and sometimes I find my clients really don't want to hear it from another person.
Right.
And if you find a way to see if, maybe it's not time for you to get help from me or from somebody else, but maybe if you have an interest in making your life a little bit better, maybe you take a look at this book and
Right.
see if there's something in there that might be able to help you with this.
Well, again, and it's just thinking about, getting rid of the stigma of going to a mental health center or Southeast Kansas Mental Health, not waiting until it gets to the point where it's that 5-year mark or when you're really struggling and suffering. Because again, if you're having a lot of headaches, they may not be debilitating yet, but a lot of us would go to the doctor and say, hey doc, I'm having some headaches. What do you suggest? There's no shame in that. There's no stigma with that. And that's really what we're wanting people to feel when they have a mental health issue or they're struggling, you know, that's not bad, that's not a wrong thing, there's nothing wrong with you. You're having a symptom, your physical body is having a symptom. Let's see if we can help you out with that.
One of the things that I've learned through my study is that, and not even supporting what I do, but supporting information in general, is that compound therapies are much more effective than singular therapies. And so let's take smoking for instance. Okay, a lot of people are triggered to smoke when they're stressed. So maybe it's one of those things that see your primary care provider, as well as get help from Southeast Kansas Mental Health Center, and work at it together. Because trying to change a habit like smoking, you need support beyond a patch or gum or something along those lines. And I think that's something that our society, our health systems, that they're missing at this point, is we'll address one side of things, but we don't address all sides of things.
That's something that we utilize, that team approach, every day at the center, because we've got kiddos that come in and, you know, maybe they're having some issues with anxiety. Well, you know, coming in to talk with the therapist, process through, you know, when are you feeling anxious? You know, what does it physically feel like when you get anxious? Do you find there are things that make you more anxious than others? Trying to figure some of those things out, but then they can work with a case manager in the community. We have wonderful workbooks we do with the kids. We have movies. We have all kinds of things we can do to continue that conversation about anxiety. We have parent support staff that can work with the families. You know, can you kind of chart for us over the next couple weeks? When do you see your child getting anxious? Let's really attack this from, you know, compound from different people and different entities in this child's life. We can also go into the school. The schools are so open and letting us come in, because, you know, if you have a child in class that's having some behavior problems, and every time it's time for math, the child really gets upset and they shut down and they put their head on their desk and they won't do their work. Well, that may just appear that child doesn't want to do their math, or they don't like math. You know, it may be an anxiety issue. That child may be so fearful of doing something that they feel like they're not going to be good at, or that they don't understand. That's their coping skill. You know, if they just shut down, they're not able to say, I'm anxious, I need some help with math. And so we can go into the school setting too and help that child work through those anxieties.
That's excellent, because, you know, we don't know what it is. It could be that this child does all right with math, but has been put into a spotlight. You know, being the youngest of three and knowing other youngest children, that youngest child syndrome.
Yes.
There's a lot of things that go on along with that. But a lot of times we're compared to our older siblings if we've all had the same teachers, stayed in the same school system, and if we, you know, if they excelled in something and we didn't quite do as well as that, then sometimes the comments made, although not
a lot of pressure.
A lot of pressure, and that really weighs down. So, you know, sometimes it's just having that child understand that that you are good, that, you know, you excel in other things, and because you excel in other things, you can also excel in this. There's just so many different ways that we can approach issues for children in school.
Right.
Maybe it's learning from a different person, a different style is another thing. That everybody has different learning styles, and if you aren't good learning one way, you may be good learning another way. So maybe your classroom isn't your best learning area. Maybe it's the teacher that you have. I'm not trying to slam teachers, but maybe their presentation style isn't the right way. It might mean that you just need to do a little extra work. If you really want to excel, if you really want to improve, you might need to do a little extra work on your own time to learn in a different style, different manner. And so there's so many different things that if somebody just reaches out and talks to somebody,
Just to get the support.
Get some
And
ideas.
the teachers that we work with in all 6 counties are so wonderful. And, you know, they really, have wonderful communication with us. You know, we may call and just say, hey, how's little Billy doing? We know he had a rough week last week, and they're so good about calling us back when they have a break or after the school day is over and just saying, you know, here's what I'm seeing being successful for him. Here's what I'm not seeing him be so successful at. And it just really helps having that communication, because then when our staff goes out into the community to work with these kiddos, we can be that support person that says, hey, great job. Your teacher said you did great this week. You know, you asked for help when you needed it. Or if they were struggling, you know, what else can we do to make you feel comfortable when it comes time to do that activity? Just really allowing them to be able to say, the child, you know, this is hard for me, or I like what we're doing here. Can we keep doing it? But it's listening to the child, just listening to them.
And sometimes that's so hard to do, is listen to the child when you come home from work and you've had a bad day at work, and you come home, there's bills and maybe a notice for this or that, and everything is just compounded. I now have to make dinner, and I don't know how single moms do it, but these are things that when you're in these situations, sometimes the children don't get heard. And
I think it's always a good idea to just make a habit of at least making sure for 15 minutes that the television's off, the cell phone's off, the computer's closed for 15 minutes, and just making sure we all remember to say, how did it go at school today?
That's a very good point.
How did you do at school today? You know, no distractions, no phones, and just helping the child to feel like they're being heard.
And you know, there was, our church had a little something a couple of years ago where it was sharing your highs and sharing your lows, and it was a good idea, but it almost sounded forced and ritualized. So not only just, okay, well, darn it, I gotta spend 15 minutes and talk to them, how did you do today at school, you know, stop and actually be in that moment to be compassionate and truly concerned with, how was your day today? You know, what tell me about how your day went. And you'll be surprised how often, once you break that barrier, that child will open up and talk with you.
And they know. Kids are smart. They know when it's okay, what was your best thing that happened today? What was the worst thing that happened today? Tell me, do you have any homework? You know, they know if you're in the moment or not.
And that's so very important, being in the moment and actually listening.
You know, and it gets, I don't want to say more important, but it just really kind of cranks it up a notch or two as they begin to go into middle school, because there are so many changes with, you know, prepubescent kids. We're having body changes, we're having emotional changes, you know, the hormones are so much different, and kids really can begin to struggle at that age if they don't have a good support system, and we see that so much. It's hard to navigate in any grade, you know, sometimes if you've got things going on, especially at home, but when you start having those changes in your body and your hormones, you know, without good support, kids can suffer.
So, if there was something that you wanted to say to the audience, you know, I'm thinking for myself, so many people, you know, are so busy, so in a hurry, and that's the way we are today. I gotta go. What would you say to somebody to, maybe there's, you know, if you're experiencing this, be looking out for that, or is there something that you want to relay to our audience that
really
help them remember this?
Just reach out. You know, if you're having struggles, if you're having symptoms, if you see your family members having symptoms, there shouldn't be shame in reaching out. It's okay to go to the doctor with a headache. It's okay to call the mental health center if you feel like your kiddo's struggling with something. You know, don't wait the national average, which is 5 years, to get that. That's just suffering that doesn't need to happen. And the more we as a society are comfortable with reaching out and getting support, you know, as the generations go on, it becomes less and less of a stigma. And that's why we go out so much and do the educational piece, because you shouldn't have to feel bad for getting support that you need for your family. That's the smart thing to do. We're here to help you. We've got really caring people that work here and have been here for years and years and years, and want to give you information, want to help share and partner with you in finding the information that you need. We may not have it, but if we don't, we can find it. We can get it for you. And so, you know, if there were one thing I would want to really get across, is just don't let the stigma of mental health center or mental illness, don't let that stigma stop you from just reaching out and making a phone call. It may not be for you a long-term thing, and that's okay. We're not there. We don't we
don't
want to
wanna
be
be.
out. We
Yeah.
want to back out because that means you're doing better and that means you've gained the skills
Yeah.
or the ideas that you need to help your family function in a better way or for you. So just don't let that stop you from calling.
One of my instructors, he's actually a marriage and family therapist, but he also does hypnosis. And he says you can apply it to any field, whether it's marriage and family therapy, LPC, hypnotist, or anything like that. You know, what what is the goal of a really good therapist or a really good hypnotist or a really good whatever? And that's to be able to say, would you like fries with that?
Yeah.
Because we don't want to keep you around.
Right.
We want you to get better. We want you to...
The goal is to help, help you gain the skills and help you gain the tools you need to be able to say, oh, okay, I got this, or, I've figured this out. And if we've got a kiddo that has an anger management problem and we're fighting with brothers and sisters and we're back-talking mom and dad and we're, getting into a little bit of trouble at school, if we can work with that kiddo and help them, do something simple. We have all kinds of little sayings that we do with the kids, just stop, think, and then act.
Oh, yeah.
If we can just give a kid that skill, that's not just going to help that kid at home, at school. It's going to help them when they get relationships as adults, as they go into the workforce. That's going to help them for the rest of their lives. So just, maybe one little skill that we can help them practice with and gain.
There's one thing I wanted to comment on, something that you said just a few minutes ago, and that's the suffering. And I believe his name is Stephen Hayes. He's a clinical psychologist. He says that there is pain and then there's suffering. And there's psychological pain, there's physical pain, there's even that anger is a type of pain, that there's pain and then there's suffering. And suffering is all the unnecessary extra that we put on top of the pain. And so if you feel that you've been suffering, if you feel that life's getting too much, I don't know what to do with this situation, that situation, my kid looks like they're struggling in some area, I don't know what it is, then like she said, reach out. There's places to call, there's people to talk to, there's information to help you. Whether you're ready to do this with help from somebody else or to do it, to look into it on your own, just stop and be aware, be mindful, listen to what's going on around you, and see if you want to change your quality of life from this point forward. And if that is the case, then reach out. Southeast Kansas Mental Health. Maybe the first stop for you might be your primary care provider to say, okay, I got this stomach ache, it keeps coming back, so they can rule out medical issues, and then they can say, you know what, might be a stress-related component. Have you considered this? So I hope you've been able to take something from this today. Look around Chanute, look around our viewing area, look around wherever you're at watching us on the internet. You'll find that all around us today we deal with a lot of things, and what we need is a little help sometimes. Don't be afraid to ask for help. From Channel 5, for Peace of Mind, this is Adrian Madril. Thank you very much.